Well, Justin, some startling and surprising health news that has people asking, how old is your heart? New statistics show that your heart's age may be very different from your chronological age, depending on a number of factors. The results could help doctors predict a patient's risk for heart disease or stroke. John Roberts is live for us in Atlanta with more on this. Hi, John.
Heather, good afternoon to you. All of this released just a few minutes ago by the Centers for Disease Control. It's a new way of looking at heart health that doctors think may make it easier for people to understand. How old is your heart compared to how old you are? Using data from the huge Framingham Heart Study, the CDC found 69 million people in this country have a heart that is 5 or more years older than they actually are. The average for men, nearly 8 years. The average for women, a little more than 5 years. CDC Director Tom Frieden tells us why.
The main things driving that are smoking, high blood pressure that isn't well controlled, high cholesterol that's not adequately controlled, and weight, diabetes, and physical activity.
There are racial and ethnic differences as well. Blacks tended to have the oldest hearts, an average of 11 years older than people actually were, followed by Hispanics, whites, Asians, and others. Your heart age tends to increase as you get older. The greatest heart age is for those who never went to high school, so education plays a key here. The lowest for those who went to college. That's because those people tend not to smoke. They tend to eat healthier, tend to exercise more. And your heart age decreases as your income rises. And there are regional differences as well. Take a look at this. States with the oldest heart age: Mississippi, Louisiana, West Virginia, Alabama, and Arkansas, which tracks almost identically with rates of obesity and smoking in this country. The good news, says Dr. Frieden, for most of us, we can make changes that will make a difference. What can we do to reverse this trend?
Well, first and foremost, don't smoke. Second, know your blood pressure and get it under control. Third, make sure that you do whatever you can to eat healthy, get your cholesterol under control, and try to stay at a healthy weight.
Now, it is actually possible for our hearts to be younger than we are. If you want to calculate your heart age, you can go to the CDC website, cdc.gov/heartdisease/heartage.htm, put in either your body mass index or, if you know your cholesterol level, that will give you an even more accurate reading of how old your heart is compared to you. Heather?
All right, John Roberts, live for us. Thank you. For more on this, joining us now is Dr. Kevin Campbell. He's a practicing cardiologist and assistant professor of medicine at the University of North Carolina. Thank you for joining us today.
Thanks so much for having me.
So you just heard the report that John was talking about there. Your initial thoughts?
You know, I think this is a great opportunity for us to take stock in the heart health of Americans. You know, as a whole, we're doing a pretty poor job of preventing heart disease. This is another tool that we can use to engage patients in their own heart health and really affect outcomes. If we make changes, we can decrease deaths by 200,000 a year if we make changes.
69 million people have a heart that is an average of 5 years older than them. How do we turn this around? What are some things that we can do?
You know, it's back to basics. Eating a healthy diet, exercise, move, exercise 5-6 days a week, even if it's for just a little while. Try to make healthy lifestyle changes, such as giving up smoking. Rather than eat fast foods, eat healthy fishes and Mediterranean-type diets. It can make an enormous impact on your cholesterol, your high blood pressure, your diabetes, and your heart health.
And when it comes to diagnosing any of those, does this new information that's out today help you as a cardiologist when you're dealing with a patient?
You know, I think when you sit face-to-face with a patient and tell a patient that your heart is 10 years older than your body, and if we don't do something soon, you're going to have a fairly significant risk for having a heart attack or stroke, that's very powerful. And I think that message may help us motivate patients to get off the couch and exercise and eat better.
All right. Thank you so much. We appreciate you joining us today. And this possibly some good news for folks because they can turn it around. Thank you.
Exactly. Thank you.